Good day everyone, I am Joanna Duran, a second-year student of BSN2 Section 12 and from Davao Doctors College. And today I will be doing a return demonstration on the administration of oral medication. Oral medication is a convenient, cost-effective, and most commonly used medication administration route. As a nurse, it is our duty to ensure that the right medication is properly drawn up in the correct dose and administered at the right time and the right patient and the right route. And by doing so, it can help limit or reduce the risk of administration error. So first, we're going to check the doctor's order to know what medication should be given to the assigned patient. And now, knows the reason why the client is receiving the medication. This is to prevent prescription errors and consequent risk of patient. And third, we're going to check the MAR to ensure the safe medication preparation and administration. And check for the drug name, dose, frequency, route of administration, expiration date of administering the medication. This is because orders for certain medication like narcotics and or antibiotics expire after a specified time frame. And now we're going to verify the client's ability to take medication orally. Determine whether the client can swallow, is NPO or nothing by mouth, is nauseated or vomiting, and has gastric function or has diminished or absent bowel sound. And prior to the conduct of the procedure, we're going to doing the hand hygiene. This is to deter the spread of microorganisms. And arrange and organize medication trays and cups in the preparation area, including the medication tickets, if not using MAR. This promotes organization, which save time and reduce chance of errors. And now we're going to prepare medication for one patient at a time. Obtain correct drug, compare the name of medication on label with MAR or medication ticket, and exit ADS after removing drug. One of the safety consideration in administering medication to avoid switching of medicines of different patients. And now we're going to check or calculate drug dose and necessary double check calculation, check the expiration date on all medications, and return outdated medication to the pharmacy. If there are any, check the record of medication. This is to reduce the medication error. And before that, we're gonna prepare all the materials needed. We have here the doctor's order, and then the medicine tray, and the medicine cup, and also the medicine. So now place the package unit dose or capsules or tablets directly into the medicine cup. Do not remove medication from the package until at the bedside. It can affect the medicine sterility. The medicine packaging also protects the medication from heat, air, light, and moisture. Exposure to these elements may affect the effectiveness of the medication. So if using a stock container, pour the required number into the bottle cup and then transfer the medication to the cup without touching the tablets. Now, break only the squared tablets if necessary. In order to obtain the correct dosage, use a cutting or spitting device. This is to failure to obtain the correct dosage may cause underdosing, which may lead to reflectiveness. And if the client has difficulty swallowing, check if the medication can be crushed, and if acceptable, crush the medication. If unacceptable, ask the pharmacist if you can have other versions of the medication on hand. And then place the prepared medication and MER together on the medication cart. And then recheck the label on the container before returning the bottle, and then box or envelope to its storage place. And avoid leaving prepared medication unattended. And then lock the medication cart before entering the client's room. And now we're going to check the MER or room number of the patient. Okay, so now I am going to introduce myself to the client. Introducing oneself to the client is a form of basis of therapeutic of nurse and patient relationship. So good day, ma'am. I am your student nurse for today from Duran Doctors College. And may I see your wristband? And please state your full name and your birth date and your age. Okay. So now we're going to provide the client's privacy. We're going to lock the door and close the curtains. So now we're going to explain the patient why she needs the medication. So ma'am, the medication colchicine is used to prevent or treat symptoms of gout like nausea, vomiting, and etc. It is important to discuss everything to your client. So now we're going to assess our patient into the sitting position. Now assist the client to a sitting position, or if not, possible to a side lying position. So now, if not previously assessed, take the required assessment measures such as a PR, RR, and BP. So since I'm done doing assess his vital signs, now compare the names of the medication and tables with medication tickets at the client's bedside. If using the MER, scan the client's barcode to verify the administration of medication, pick up due medication, and compare the tables with barcode on the drug and MER. So now give the medication at the right dose and at the right time. So give the patient sufficient water or preferred juice to swallow the medication. And if the patient is unable to hold the pill cup, use the pill cup to introduce the medication into the patient's mouth, one tablet at a time. If an older child or an adult has difficulty swallowing, ask the client to place the medication at the back of the tongue and before taking the water. And if the medication has an objectable taste and the so stay the patient until all the medication are swallowed. And now we're going to document all the medication. And now record the medication given, dosage, any complaints or any assessment of the client, and your signature. And if the medication was not refused, a and now record the medication given, dosage, any complaints or assessment of the client, and your signature. And if the medication was refused or omitted, record this fact on the appropriate record. Document the reason when possible and the nursing action according in an agency policy. And now dispose of all the supplies appropriately. And now we're going to replenish stock and return the card to the appropriate place and discard used disposable supplies. And that's all for my return demonstration.